Following amendment, clerk will read the amendment.
Amendment by Turner of Harris.
Chair recognizes Mr. Turner of Harris.
Thank you, Mr. Speaker and members. This is a very direct amendment. I will tell you what this amendment simply says. It doesn't change anything in the bill. HB2 remains the same. I do not change anything in the bill. What it simply says is that under HB2, we are requiring existing businesses to change or to undergo an expense from being clinics to ambulatory surgical centers. Based on the data that I have received, in order for these businesses to be retrofitted to meet the requirements of this bill, if they are 4,000 to 5,000 square feet, it will cost approximately $1.4 to $1.6 million each. And if they are to build new facilities, a new facility to meet the requirements of this bill, it will require $3 million to do that. What my amendment simply says, and accepting everything that Representative Laudenberg says, that this bill is about the health and safety and protection of women, assuming all that is said is true. And Representative Ziegler, assuming that our number one priority is to protect the women and protect these unborn children, then I do not think that we should put forth a mandate without making sure that the funding is also available. So the only thing this amendment says is that for those facilities, those clinics that currently exist, that the state must provide the necessary funding to be retrofitted in order to meet the mandates of this bill. And for those facilities that are built after the enactment of this legislature, the cost should be borne solely and squarely by them. So essentially it says no unfunded mandates on businesses in order to meet the requirements of this bill. That's all that it says. And I would like to think that many of my colleagues on this floor on both sides of the aisle would join me in preventing any unnecessary mandates being imposed on our small businesses.
Mr. Speaker.
What purpose, Mr. Turner?
Yes, I yield.
Mr. Turner,
Yes, sir.
yields.
Thank you, Mr. Speaker. Thank you, Mr. Turner. So I think you've got a really good amendment here, and I want to just emphasize something for the membership and underscore something I think you just said, because I believe earlier in the debate on this bill, it was erroneously stated on this floor that a clinic could simply upgrade to be an ambulatory surgical center for about $100,000. And you've just presented some data that I believe you said it was from the Association of OBGYNs, that the costs are much higher than that. Is that right?
That is correct. For the cost to retrofit a facility from 4,000 to 5,000 square feet, the cost will be anywhere from $1.4 to $1.6 million.
Right. And if someone were to construct a new ASC, say they had a clinic and it wasn't able to be upgraded and they had to build a whole new building, is it true that that could cost around $300 to $350 a square foot, or a total cost of $3 million?
That's correct. For a 5,000 square feet facility, the cost could be approximately $3 million, Representative Turner.
Okay. Thank you. And I know that it's been covered before, but I think it's worth mentioning again. Currently, the only facilities in the state that currently meet the ASC standards in this bill, all of them are in urban areas. Is that right?
That's correct. Primarily there, and I think in Houston, Dallas, and San Antonio.
So what we're talking, what your amendment would do is enable clinics that would be forced to upgrade to an ASC, even though we haven't been provided a good medical reason why that should be necessary. But assuming we pass this bill and they're required to do that, your amendment would see that the state reimburse those facilities in El Paso, in the Rio Grande Valley, and Waco, and Bryan, and smaller communities around the state where these clinics provide an array of vital services that may not be able to with passage of this bill.
That's correct. The amendment only applies to those facilities that presently exist, that we will provide the necessary appropriation in order for them to be retrofitted to meet the requirements of this bill. To the extent we don't want any facilities to close, as Representative Laudenberg has indicated, and to the extent we want to upgrade them And to the extent that women's health and protection is a priority, then we should fund that necessary priority and not let it be an unfunded mandate.
And because this is, as we've been told repeatedly, about the health and safety of women, this amendment essentially asks the legislature to put its money where its mouth is.
That is absolutely correct.
All right. Thank you, Representative Turner.
Mr. Speaker, would the gentleman yield? Mr. Turner, do you yield?
I'll be more than happy to yield.
Gentleman yield.
Representative Turner, as you know, we do pass lots of legislation that increase licensing, that we increase requirements for all kinds of businesses, don't they?
We have made a lot of unwise decisions by imposing unfunded mandates on local governments, on local businesses. We can stop that practice today.
So you've never voted against all the regulations that we've increased on businesses and stuff like that?
I can't say I voted against or voted for all of that. I can certainly say to you that I have heard over and over again conservatives talk about unfunded mandates. I have heard people criticize Obamacare for imposing mandates on businesses, on individuals. I got that message loud and clear.
Can you name me any time that we said, okay, we're going to increase the standards here of any other industry and we're going to give you the money to do it?
Well, I think it's an important practice that if we're going to impose mandates
There's
on
never
folks,
been that, have we? We've never done that. Why should we do it with these guys?
Well, Dr. Ziegler, I think we need to be consistent in our philosophy. The amendment is simply saying no unfunded mandates. I'm not changing any of the requirements in HB2. What I'm simply saying is that if we're going to impose this on these businesses, then we need to step up to the plate and pay for our priority. If it's important to us, if saving these women is important, if it's a high priority, then let us reflect that in our appropriation. Let's provide the funding, and then let's not have any unfunded mandates.
Representative Turner, I worked in the hospital industry for 33 years, and every year the majority of the hospitals were constantly upgrading to meet the standard of care. There's not one reason in the world why we ought to pay abortion clinics to do exactly the same thing we expect the hospitals to be doing all the time.
Well, let me ask you this, Representative Ziegler. Let me ask you this. Did we enforce those mandates on them statutorily, or did they do that on their own? There is a difference. There's a difference between private business recognizing the need to make improvements, and then there's a difference between government imposing those changes on private business. Now you choose.
And when the private industry won't do it, then we do it for them.
Well, I don't like that. That sounds like big government, and I don't think big government needs to be in everybody's business.
Mr. Speaker, for what purpose, sir?
Let's be consistent.
Mr. Turner, do you yield?
I would be more than happy to yield to my good friend, Representative
Well, I
Terry.
tell you, I enjoy you so much, Mr. You know, here's the deal. Planned Parenthood has about $1.2 billion in gross revenue on the last public report. Planned Parenthood showed $87 million net on their last public report. You divide that out amongst the 47 clinics or whatever the number is.
But we don't provide any funding to Planned Parenthood.
You know, I'm just saying that if these clinics are concerned about women's safety and not meeting these standards, that organization has a net $87 million profit.
Oh, I'm not on the board of Planned Parenthood.
I'm suggesting to you that they're not.
Representative Perry, I'm not on the board of Planned Parenthood. Planned Parenthood is not here in this discussion. We don't provide funding to Planned Parenthood.
We are requiring standards. I do agree with you that for the health and safety of women.
Let me ask you this. Is the net intent of the bill to eliminate these clinics? If that is the end goal, I accept that. I don't argue with that. If the net goal is to get rid of these clinics that provide abortions, whether it's 2 weeks or 20, I accept that. But if the goal is, as Representative Lauderberg has discussed, to protect the health and safety of women, and if this is a mandate by Texas state government, then Texas state government ought to pay for the mandate.
Here's the goal of HB2. The goal of HB2 is to provide a safe environment for these procedures to be done in.
Then let's pay for it.
And then therefore, if this organizations that support these clinics, because we don't, but if these organizations and we raise standards on a lot of things across this board. We got standards for plumbing, we got standards for everything. But in this state, if you're going to have a clinic that provides these procedures, we want them to be the safest environment possible. And when an industry is making an $87 million net profit, there's more than adequate resources to fund those clinics. That's what these clinics are making.
But Representative Perry,
and you had a cost of $1.5 million. I've seen numbers as low as $40,000 to $51,000 per clinic. It's based on facility. So if they're truly about providing safe procedures in those clinics, then they're going to have to think a priority of whether they want to spend some of their profits on that. Thank you.
Representative Smithy raises a point of order. The gentleman's time has expired. The point of order is well taken and sustained. Chair recognizes Representative Lautenberg in opposition. For what purpose, Mr. Stickland?
I move that we add Representative Turner's comments about not wanting a bigger government placed in the journal.
Members have heard the motion. Is there any objection? Chair hears none, so ordered. Members, all of the comments from beginning to end from Mr. Turner will be placed in the journal.